I'm Sean. I'm one of the current fellows. I'm a family nurse practitioner in Rochester, New York. And I practice primary care and a lot of harm reduction in an inner city clinic and a mobile access clinic in the city. What drew me to the fellowship initially was I kind of felt like my contemplative practice, which for me is a Buddhist practice, and my nursing practice, they always felt like very separate, siloed entities of myself. And I kind of wanted to look into like learning more about how to kind of reconcile these two things at a time when it felt important, against the backdrop of the pandemic and, just a really sick healthcare system. But the most meaningful thing that I've really taken away from the fellowship so far is the fellowship itself, the connections that I've made with the other fellows. I feel like I've made real, just meaningful friendships and connections with people that would take years to kind of foster in just a purely clinical setting. Couldn't take like the course of a couple of training days in this fellowship. And it really just kind of helps me to, you just feel so supported to be exploring these ideas with people that are like-minded and care about the same kind of things as you. And, I think that it's just the most meaningful thing is just the connection to other people. And it's just really made me sort of reconnect with why I wanted to get into nursing in the first place. So that's what I have to say about it.
My name's Wendy Wallskog, and I'm an anesthesiologist in the Twin Cities in Minnesota. And I work at a level 1 trauma hospital and then a very busy OB practice. And Sean took my answer. By far, the most meaningful part of the fellowship for me is the connection with the other fellows. But I'm going to add something else. The second most meaningful thing for me is to have practical ways to implement the Buddhist principles into my work life. So part of the fellowship, every Monday, there's a video by one of the training teachers, and they ask us a question or invite us to try a practice at work. And when I've done it, it has changed how I show up at work and how much I enjoy it. I feel more fulfilled and more purpose. And I really didn't think it was possible to do that, especially because it doesn't take any more time. It's just how I'm showing up has changed. Thank you.
Barrell. I'm a family doc in Ventura, California, and also have been running a large group of 30 primary care doctors and 150 employees in a private practice. And for me, I was interested in this fellowship because I was looking for a Sangha. I was looking for kind of someone to hold me kind of accountable or help me cultivate a daily practice. I was fairly sporadic, and so I really was looking forward to deepening that into kind of more integration in my life. I wrote like one sentence which I think distills down what I love about this fellowship. I said it combines fellowship with colleagues and mentorship and wraps it around a Buddhist framework for how to not just endure but actually enjoy this life. And I think what I have found most fascinating is I've been pathologically busy for much of my life, as probably most of the clinical colleagues on this call can probably attest. Medical school is not a place, that track is not one that lends itself to a lot of introspection and quiet and space. And so, while I've been able to quiet down, both personally and collectively with my colleagues, I've been able to really pay attention to exactly how busy my life is. And also it's helped me kind of peel back the layers of understanding in terms of, like Sean said, like what brought me to medicine in the first place. And also, what I want to continue to do from here as a more intentional choice. One of the questions, it takes you through the eightfold path. And so you're looking at right livelihood and right action and right concentration. And so, and these deep kind of thought-provoking questions really resonate as much as Chodo, who ends many of our sessions with the evening Gatha, and his words just resonate almost on a daily basis. And it's like, take heed, do not squander your life. And I think for all of us, most of the colleagues that I've talked to, we're all so kind of in awe of the simplicity of the message, and how obvious things are once you can kind of collectively peel back all of the residue that we've built up over our training. Mm-hmm.
Hi, everybody. My name is Cynthia Rivera. I'm an infectious disease specialist all the way down in Miami Beach, Florida. So in answer to your question, with patient care, I found that there's an intrapersonal component to the fellowship and an interpersonal in the Sangha, in relationship with our patients, in relationship to our staff, that I've found this fellowship has birthed a curiosity in me, an interest curiosity, as one of our faculty members likes to call it, Dr. Brewer, that has created a playful quality to my day, to my interactions with patients, because there's this fellowship has inspired a deep listening and a deep curiosity about my patients are, who I am in relationship to my patients. So while we don't have, I guess, simulated clinical encounters, we're asked in the clinical exercises that Tirone mainly prompts us in to drop in, to have moments of deep listening with our patients and shift the paradigm from wanting to fix or heal them to seeing how we can enter in partnership with them. So it's a shift to one compassionate being joining another compassionate being, and that in and of itself having healing qualities. And that's been one of the many meaningful parts of this fellowship. We do have, I don't know how it'll shift from year to year. Hopefully, I'll put the intention out there post-pandemic. This year we had Saturday sessions from 10 to 4:30 once a month on Zoom. Every other week we're still in the fellowship visiting faculty sessions that are from 7:30 to 8:45 Eastern time. We have clinical exercises and videos that are done online. And we have 2 retreats. We had one incredible retreat in New York City in the Zen Center where Chodo and Koshin are sitting currently. And we will have our final retreat in New Mexico at a ranch in New Mexico that I'm very much looking forward to.
Thank you. We actually have 2 surgeons this year. We have a brain surgeon and a neurology surgeon and a heart surgeon, cardiac surgeon this year. And what do you think, Alberto? Do you think there's...
And who are you, Alberto? Where are you?
These are all excellent questions. I'll start with the easy ones first. So I'm Alberto Montero. I'm a medical oncologist. I focus on breast cancer, and I'm the director of a breast cancer program here in Northeast Ohio, in Cleveland at University Hospitals. I think it's totally, this program is totally geared to anyone, whether you're a surgeon or you're somebody like me who's an oncologist. You would never ever want to have a procedure, have me do a procedure on you. And I like to echo everyone that for me, really, it's the community, it's the framework to help grow personally. And then also, I also like the program. It sort of pushes you, as much as you allow it to, out of your comfort zone, and you end up doing things, wonderful things in your practice. We have an end of the year project, and I ended up doing a great humanities-based project at my cancer center called Right Club, where people would share their experiences through the lens of taking care of dying patients, with cancer, and they would write narratives or poetry, and it was really a beautiful thing. And I don't think that's anything I would have done just on my own. So I sort of needed a little loving push from the New York Zen program to do something that is definitely out of my comfort zone.
So my name's Indu. I'm a neurologist here at UCLA, and I run our Center of Excellence in Parkinson's disease at the West Los Angeles VA. I think to answer a few questions, it sounds like there may be sort of a transition point that many of us get to in our career, where we've been doing things a certain way for a number of years and are trying to find out sort of how to spend the rest of our days in medicine and in life, I guess. And I felt like I was at the crossroads of that, having been a neurologist for about 20 years, also with administrative debacles to deal with at the VA, as well as trying to model and train students that I saw a lot of potential in and wanting the best for them, and not wanting to present, a very grim picture of what the reality of practicing medicine is and has been, and then enter the pandemic. So, the crossroads that I was at similarly was whether to leave medicine, whether to affect change within medicine, or whether to just keep doing the usual baseline of practice. And I think this fellowship has led me to feel like I can change things within the field and be inspired by 29 other people who are, I think, trying to do the same, along with guidance from colleagues that are in medicine and out of medicine. Some of our guest teachers are as well people who are thought leaders and have written books and have just been really inspiring. Dr. Lodog is just an inspiration, and then guidance from amazing teachers who also have hats as chaplains and psychotherapists and other allied sort of professionals that know about, end of life care and know about different sorts of areas in medicine in which there's so much to learn and so much that we don't know about how to help people. And we don't have cures, and we just have ways to just sort of, be there and be with people and be with each other as we're trying to do that and do our best and show up. So I think I echo the fact that I think it is a good fellowship to do, simply because of the sort of ability to look sort of at what you've done and where you are and where you can be and how we can change things together. So I think that many of the things that you have all said as people who are considering this seem like the right reasons to consider this, to be honest.
I had 3 kids. I worked full-time as a doctor. I continue to do so. There is no good time in terms of except for the present. And I'm really serious about that, because the tools, the community, the vulnerability, the full heart that this fellowship offers can only enrich your life, and very well may inform you along with whatever you're learning and practicing in your other fellowship. There's a lot of reading. There's commitment. It takes commitment to show up for these Saturday meetings in particular, which are all day affairs. But I look forward to them so much. I've never had anything that involved almost a 7-hour meeting that had me so excited each and every time. And I don't have a whole lot to add to what the other fellows have said, except for you might come into a fellowship thinking you're going to get something out of it, And I think what I've really learned from this fellowship is that everything I need is already here. And this community will be with me, I'm sure, for the rest of my life. The love that I am learning to own, that's always been there for my patients and for my coworkers. I just have a different way to express it now. Like it's almost like a permission has been given in doing this study. My attention to detail, my intention in each and everything I do all day long has been informed by this fellowship. For me, it's been life-changing. So I'd say do it now.
I want to piggyback off what Jennifer said. I wish I could have done this in training. So I'm 15 years out, and it would have changed me. I mean, it's changing me now. So if you can do it during your fellowship, 100% do it. I also have a really varying work schedule. So I work overnight once a week in the hospital, and I've had no problems getting to sessions. And like Jennifer, I look forward to them. Over and over again, I say, this is water in the desert.
I'm madhavi, I'm a PA. So I come and I practice in integrative oncology now. I've spent most of my time doing medical oncology prior to that. My other life is I'm a practitioner of insight meditation. I've practiced Vipassana meditation for a very long time. Combining or even deciding how much to practice is not an issue at all. Actually, this whole curriculum is based on allowing you to figure out how is it that you want to practice, how much do you want to practice, how do you want to weave in your practice, your meditation practice, your spiritual practice, your philosophical practice into your medical practice. How do you make it seamless, as it was said initially? But the personal, the interpersonal, and the clinical, how do you make it, how do you take the clinical into you, and how do you take you into the clinical and make it more authentic for you? And then when you do that, you can then even take it to where you're working. And what better group of people to take this practice to than the prisoners, the breath awareness, or just like slowing down, a pause. How do you calm them down? How do you calm yourself? Because your energy is what's going to go out to them as well. So all of that comes, it just helps you kind of integrate all of that through a sort of deconstructive process, like where you are understanding the complexity by going through the exercises that we go through, the prompts and the questions, the writing, the reading, the small groups, the big groups, when we meet once a month, every 4 to 6 weeks kind of thing, it just kind of, and through others, you kind of understand yourself. So that had been one of my challenges, because as a PA, I've always been under a physician, quote unquote, right? Like I didn't have my own say. I always had to kind of do whatever the scope of practice the physician allowed me to do. And this has allowed me to open up and kind of practice in a way that I'm no longer afraid, or I don't have, I can still be true to myself and kind of fit in with everything else that is required of a medical practice.